team. It's Jane Shukitis. Um, Recently, in some of the focus groups that we've been doing, it was brought to my attention that folks would like to hear from me more frequently. So we're trying this. This is our first attempt at doing a YouTube video format to share some thoughts and to tell you a little bit about myself and what's going on in the organization. So we're starting this first one with telling a little bit about who I am, what brought me to this place in my career in this position, and a little bit about where we're going and why, and just kind of see how this goes. So we'd love to get your feedback after we do this the first time. So first of all, a little bit about me. I think many of you probably know that I am a nurse, and I loved being a nurse. I graduated from Roberts Wesleyan College, and my first job, by the way, I say that I bookend my careers with the University of Rochester. My very first job as a nurse was at Strong Memorial Hospital. But I spent 33 years at was originally Park Ridge and then Unity, and now what is Rochester Regional Health System. And I am absolutely delighted that I'm capstoning my career with UR Medicine Home Care. I couldn't be more happy and just satisfied with all of the things that we're doing here and how much I appreciate being part of this team. So I want to start with that. I want to tell you a little bit about my career path, because a lot of people have asked me about that. As a nurse, when I first went to Park Ridge Hospital, I within about a year was tapped and offered the opportunity to become a nurse manager. And my very first job was to transform a surgical unit to a long-term care unit. And I fell in love with the project management, with the leadership opportunities, the development of a new service, and also the care of older adults. I just loved all of that. I did that for a number of years, and ultimately, maybe 10 years later, I was asked if I would take the leadership of the long-term home health care program. I had never done home care, but I was interested in doing something new and different, so I tried it. I went over. It was a very small program, really having a hard time getting going. And again, I found a second passion. I loved home care. So I was able to bring all of that together, home care, leadership, developing a new program, and my real heart for older adults into my career path. And I spent the next 20 years of my career leading the development of home and community-based programs at Unity Health System. I won't go into all of what that included, but I can tell you that I ended my career there. The last 3 years, I was given the opportunity to be the Senior Vice President for Aging Services, which added the nursing home side to my home and community-based services background. So I've had a lot of experience with bringing on new programs. Home care is being at the heart of who I am and what I do. And when I had the opportunity, when I was approached about considering the CEO job at UR Medicine Home Care, then BNS, it was an absolutely perfect fit and capstone to my career. One of the very first things, though, that as I came over was to set a vision. Where did we need to go? And I have to tell you, right at the beginning, I was challenged with, even in my letter of agreement to accept the position, with how are we going to make ourselves more financially viable. But that's not the end result. The financial viability is really a means to an end, and I'm going to talk about that in just a minute. But I wanted to tell you that what the vision that I set as I first came in was what I still believe is the absolute right things that we should be doing to be successful for the long term. And if we do the first three, I think we can get to the fourth. So the first one is our relationship with the University of Rochester, really forging that great connection as a great partner. And we're doing that. We're doing that in lots of ways. We're part of the Bundle Initiative. Our referrals are growing from the hospitals of the university. Our connection in a lot of different payment models is growing. It's really great stuff, and I'd love to spend more time, but I don't want to use up all my YouTube time here talking about those things. But if you come to my chat sessions that I'm starting, I'd love to tell you more about those things. But anyway, so university connection is been one of the key things. And that's not always easy. That sometimes means taking the challenging patients, but that's what you do when you're part of a system and you're in it together, and patient-centered care. The second is being innovative. And by innovative, it's not just technology, although that's a piece of it. It's also doing best practice and looking for ways to do things better. And part of what we've done through our Destiny initiative in redesigning the way we deliver care in our interdisciplinary model, that's innovation. That's using best practice to deliver care in a better way, a smarter way. So being innovative in technology, new business opportunities, and there's a lot of stuff happening in that side as well. And then the third piece is our quality, and that's a given. People expect you to have quality right out of the gate. But last year, Center for Medicare and Medicaid Services, CMS, started doing a star rating system, and we right out of the gate we're a 4-star agency. That means we're in the top 15 or so percent of the nation for the quality that we give to our patients. And that's the really 3 key things that go into that star rating is our quality outcomes, our patient responses to the care that we give, and our rehospitalization rates. All things that we're doing great work on, and I'm very excited about. So quality. If we do those things right, then the financial results is what kind of that fourth piece. How do we get to be a sustainable business plan that is financially viable? So you may or may not know that we've struggled financially for a number of years. And we are fortunate to have a wonderful parent in the university who supports us, but that's not where we want to be. We want to be financially viable. But why? It's not the money, having a positive in the black bottom line is not the end unto itself. It's the end to a better future. That means that we can improve the benefits that we give to our staff. That's one of the number one things on my heart is to get us up and to get you, all of us, a better benefit plan. And we can do that if we're financially viable. It's to reinvest in technology so that you have the state-of-the-art equipment to do the work that you need to do. And you're not, I've heard through some of my clinical sessions that nurses have been waiting long periods of time to get laptops repaired because we haven't had the inventory needed to provide that resource to you. That's not acceptable, but that's what comes when you can't pay your bills. So it's about being financially successful so that we can reinvest in you and reinvest in our future. So that's the vision and the goal. So how are we doing? And I'm going to wrap up with how we're doing. We're really making progress. I believe in transparency. I believe in integrity and honesty. And those of you out there doing the work day to day are truly critical to our success, and I value what you do. I say frequently, none of us is any more important than anybody else. We just have different jobs to do. And my job is to make sure that you have the resources and the support that you need to do a great job in the job that you do. That's what my passion is. Sorry, I'm losing my train of thought because I get passionate about these things that I talk about. So the vision is to be that long-term successful organization, and how we're doing is making progress. So I mentioned 4-star quality organization, great results in our quality, great results in our patient experience, great results in our relationship with the university, really making some strong progress there. Really good innovation stuff. All the work we've done under our Destiny plan for redesigning our work and our lean initiatives, that's all innovation. That's great stuff. Financially, we're making progress. That's what I'm sorry I started to say. I believe in transparency. Last year, we lost almost $5 million as an organization. This year, we're budgeted to lose $2.8 million. But by the end of this year, we expect to get to close to break even so that in 2017 we actually can have a break even year. And we have been staying on plan for the most part. We're really close to that target that we've set for this year. And that's through all the hard work that you're doing to do those improvement initiatives that we've asked of you. So I'm going to end there. I'll talk more the next time, but I think that's a good start. And again, I would encourage you, please come to the chat sessions. You can ask me anything you want. We can talk more, and I can share more in those sessions. So I look forward to seeing you there. Thanks.